Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and we are streaming live from an underground bunker in an undisclosed location. No, just kidding. Actually, we are streaming live from the Moses Lake Professional Pharmacy Studio, and we have the pleasure of having Dr. Amy Beard on again today, and she is going to be discussing gut health. And I know that's a pretty broad topic, and maybe some of you don't realize how important that is, but gut health is everything. Our gut absorbs all the nutrients and vitamins and minerals, and everything that comes into our body comes into the gut. So if we don't have a healthy gut, we are not going to have a healthy body. So Dr. Beard is going to be getting in deeper into that. And Dr. Beard, welcome back to our show.
Thanks for having me again, Shawn. It's awesome.
I love it. I love it. So tell us about gut health and how you got involved in it.
Wow. So, like you said, it is a gigantic topic and one that I had to learn about through my own health experience and journey. Um, really, what led me to this point was my own issues for most of my life, involving a lot of chronic issues and also GI issues, and even to the point of being diagnosed with MS in my 30s and having most of my colon removed. And so, you know, having the colon removed was supposed to help a lot of my issues, but it caused a lot of more problems. And it was a chance meeting with a functional medicine physician that got me on the right path. And it was a functional medicine approach, which heavily involves addressing gut health, that finally got me past all my chronic issues and eliminated that MS diagnosis.
So I think maybe some people are a little bit skeptical. You're telling me that you were diagnosed with MS and you fixed your gut and that helped your
Yeah.
MS.
Yes, because your gut and the microbiome that exists within it, all those microbes. You have about, I don't know, 2 to 3 pounds of microbes within your GI tract that serve some very important roles, and especially roles involving the immune system. And MS is an autoimmune condition, right? So a lot of people don't realize that your gut basically is a huge chunk of your immune system. 75% of your immune cells lie along your GI tract. And those microbes that reside there are basically responsible for kind of dictating what your immune system does. And so, um, what you put into your mouth matters. And that's not all. That's a common mistake people believe, is that it's just about diet. That is so far from the truth. Yes, diet is important, but there are so many other environmental inputs that directly impact your gut health, which then directly impacts your immune system.
Oh, so tell me how you fix your gut health then. What's the first step you go to?
So the first step we like to do, and this is for people, if you, I think everybody should do it actually, but especially if you have had some chronic issues, is first and foremost, we like our patients to do an elimination and reintroduction diet. So we like to rule out food sensitivities right off the bat. Because if you have those and you don't know it and you're consuming those, it's going to impact your gut health negatively and cause a lot of immune dysregulation, which can be expressed very differently in different people. It could be expressed as eczema, psoriasis, depression, anxiety, joint pain, trouble sleeping, of course, GI issues, whether it is, reflux or IBS, or and a lot of autoimmune conditions are directly related to what you put into your gut, and food sensitivity. So we like to get that out of the way right off the bat. And we do ours very differently than a lot of people do, because we like to rehab the gut at the same time we're doing it. So once you start, because an elimination reintroduction diet is the first 30 days, you are eliminating the foods that are most notorious for causing problems. So that is gluten, all the dairy components, soy, corn, beans, legumes, nuts. We'd like to get rid of those. And after 30 days, we're also rehabbing the gut at that same time. Then we start eating those foods in a very strategic manner for the next 30 days, and having you document if you notice anything. because it can take up to 3 days before you notice the health effects of consuming something that just doesn't mesh well with your genetics. And so that's it's it's not as big of a deal as a lot of people like to think it is. They think it's going to be this horrific ordeal to go through, but it's not bad. And if you do it right, you only have to do it once, and then you're done. And then then if you have issues with those top offenders. Now there can be some outliers, some weird foods, some weird spices, and some other veggies that we haven't taken into account. And there's some testing that I think is somewhat reliable to use to see if you have those. So the first thing from with is an elimination reintroduction diet, but you have to do it right. And so that's one thing we like to um, focus on. And then it is a lot of the other things that impact gut health. Okay, pharmaceuticals, that's a big one. Are you taking proton pump inhibitors or acid suppressing medications? Are you taking nonsteroidal anti-inflammatory medications, which will cause something called a leaky gut
Mhm.
or gut permeability? And if that is present, you are going to have systemic inflammation. And like I said, it can be expressed in many, many different ways depending on you. So we like to get people off of those medications as well. And then there's a lot of other medications that cause problems in the GI tract, synthetic hormones, um, uh, metformin, or other drugs like that have side effects of diarrhea. I'm pretty sure if your medication has a side effect of
Right.
diarrhea, it's probably not good for your gut health. So we like to review the medications and see what if we can wean people off of those, and it can get kind of hairy with that, but that's another thing that we like to do. And then stress, chronic stress, it will wreck your gut health amongst a lot of other things. It often decreases the effectiveness of the digestive enzymes that are produced in your gut, slows down gut motility. So a lot of people will get constipated, or sometimes it will speed up motility. It kind of depends on the person, and you'll get diarrhea. So chronic stress is a big deal, and we have to address it in our patients. Sometimes, there can be extenuating circumstances where you just have to make the best of what's going on in your life. But there are a lot of people who are creating that stress unnecessarily. And so it can take some heart to heart conversations to deal with that. And a lot of the stress often comes from sleep deprivation and very poor sleep hygiene that we're seeing today. People, not getting a good night's rest, not getting to those deep stages of sleep, waking up not feeling rested. And when you don't get good sleep, your body is stressed the next day. And so we have to go over the sleep hygiene. Are you on your phone before you go to bed? Are you on your computer working? Are you drinking a lot of caffeine in the evenings? And so there's things like that where we have to address sleep hygiene and make sure people are getting the rest they need. But sleep is it's sleep issues are a kind of like a chicken or egg scenario. Is it your poor sleep that is causing your gut issues or other chronic health issues, or are those chronic health issues and gut issues contributing to your sleep problems? So we kind of have to address it all at the same time. And there's other
Well,
things.
yeah, right. Now, so on the topic of sleep, we talk about all the time is that, there's really three things that we can do to keep our bodies healthy in general. And that's diet, exercise, and sleep. And we will die without sleep before we die without any of those.
Mhm.
Exercise, we don't have to exercise to stay alive. We do have to eat to stay alive, but most of us can live without food for like 3 weeks. Whereas with sleep, we can only live for like 3 days without sleep. So if you're not sleeping, it's destroying your body, correct?
It is, and that's why sleep deprivation has been used as a form of torture. It will it and that's what it is. If you are depriving your body of sleep, I don't care what you're doing. You could be eating super clean, working out, doing everything you're supposed to do, but if you are not getting quality sleep because of poor sleep hygiene, your body's not going to work right, and your gut health is going to be impacted negatively.
Yeah, for sure. Sleep is just so important, and I think so underrated a lot of times. I know people that they eat healthy and they exercise, and they are not super healthy because they're just burn the candle at both ends, and they
Right.
hardly ever sleep.
Yeah.
And
Work, work,
it
work.
yeah,
Mhm.
and it takes their and you can see it takes a toll on them. It
Mhm.
really does. And especially I've actually had a podcast just dedicated to this. Night shift workers
Yeah.
are it's just very difficult for them, especially as they get older, to actually have a healthy lifestyle when you're trying to work at night and sleep during the day. Because we're diurnal creatures. We're meant to sleep at
Mhm.
night, not during
Right.
the day.
And I was one of those. I worked in the ER, so my shift work was destroying me, and that was one of the things that I had to address to get beyond all those chronic health problems was no more shift work,
So
which
what's
I was
some
grateful for.
yeah, exactly. So what's some of the things you do to rehab the gut, you say?
So, we put together something called, I named it the total gut job. So we're using things, we're using probiotics, of course, and that can vary depending on the person's issues, whether it's candida overgrowth, small intestinal bacterial overgrowth, or general just. Lots of times we use things like L-glutamine to heal the gut lining, along with zinc. Uh, Licorice, aloe vera. Sometimes we have to use natural antimicrobials to kind of get the balance back where it should be. Amongst the microbes that live in your GI tract, there needs to be a specific balance. And sometimes when things aren't working right, that gets out of balance. Like if people are eating a lot of sugar and carbs, that's a good way to cause candida overgrowth in your intestine. Yeast is supposed to be present in your GI tract. It's a natural inhabitant. But if you're consuming a diet that has a lot of sugar and carbohydrates or refined carbohydrates, processed foods, the yeast will grow out of control. And that's when people start complaining of food cravings, especially for sugar and carbs. And they want to blame it they're just constantly craving these things, and they think they feel like a failure because they feel like they don't have any willpower to fight it. And it's not a matter of willpower. It's like you literally have these yeast that are screaming for sugar, and they won't stop screaming until you give it to them. So
That is
that's one thing. And then we also like to include digestive enzymes before your meals, and the hardest part with that is actually remembering to take the enzymes before your meals. If someone could help me come up with a device to remind people to take those 15 minutes before meals, you would be a millionaire overnight. Okay. Um, but that's very important, is to make sure that your body actually has the enzymes present to digest your food, because when you come to us with all these chronic issues, chances are your digestive enzyme capacity is not what it needs to be. And then sometimes we'll test people for stomach acid levels. Lots of times people will come to us with complaints of reflux, or the feeling that their food is sitting in their stomach and they're belching and burping, or there's some burning. And those are the ones that often get put on proton pump inhibitors and acid suppressing medications, when in fact that is doing more harm to them, and their body is actually not producing enough of that. And so taking something like betaine to test yourself can let us know about just what's going on in that stomach of yours, because stomach acid is important, because when it empties out into the duodenum, the first part of your small intestine, there has to be a proper pH there, or your digestive enzymes don't get activated. So just suppressing stomach acid and raising that pH can be cause a lot of downstream effects that are not good in the GI tract. So that's why we try to get people off those proton pump inhibitors really quickly, and we have weaning protocols to do that.
Janet, I bet you have a comment on that. And welcome to our show, Janet.
Yeah. Hi, Janet.
Hi. Yeah. So, as far as how you approach getting off of those particular medications, because we see that too, and it seems like, I mean, it is such a high, people fail at it sometimes. And so, what is your approach to getting them off of those PPIs?
So, a lot of the stomach issues are directly related to what's going on in the intestine. A lot of them have leaky guts, and that's how it's expressed. Or they're just consuming a lot of foods that are inflammatory. And again, it's expressed like that. Stress also plays a part in that. That's why you
Mhm.
always have to address it. But we will use, and you have to wean people off slowly, especially if they've been on those medications a long time, or they'll have horrible rebound reflux and heartburn. So it really matters about how long they've been on it. But we use zinc carnosine and DGL, or it's a licorice derivative,
Mm-hmm.
um, to help soothe the stomach. And I have used it many, many times successfully when I've had cases of it. So instead of grabbing the famotidine or the purple pill, I will grab my zinc carnosine and licorice or DGL. And sometimes probiotics can even get rid of it. I've
Mm-hmm.
seen many, many, many times. So many patients have been able to get off of those proton pump inhibitors and get relief from reflux just by taking probiotics, which is,
Eh,
it's a fix, but you need to, why do you need the probiotics every day?
Well, and that's one of the things I was going to ask early on about drug when you talk about when you go over a drug list when you're trying to get their gut health. So hopefully they're not on chronic probiotics. I mean, some people are, or chronic antibiotics.
Right.
Some
Oh,
people
yes, that's
are.
a big one.
Yeah, some people are, and that's definitely a problem for your GI health because
Yeah.
antibiotics kill the good bacteria in our GI also.
Mhm.
But what about having a history of being on antibiotics many times? Shouldn't they address that with a probiotic for at least a while?
Yes, and we often see people's health issues exacerbate or express themselves after they've been on antibiotics, especially long-term antibiotics, because, like you said, it's destroying all those beneficial bacteria as well as the intended target, and so that causes a lot of dysbiosis and yeast infections. Women know all about that because if your colon is not doing what it should, your urogenital tract usually isn't as well. And so you're basically I forgot where I was even going with this, but the antibiotics, we tell people to take probiotics in between doses of their antibiotics while they're on it, and then at least for 2 to 3, preferably a month later after they've finished that course of antibiotics.
And now, when you're talking about rehabbing the gut and you're talking about using some supplements, um, are they going to use supplements, digestive enzymes for the rest of their life?
No.
Or okay, so can you explain that? Because here's one thing I'm just going to share is that I believe supplements are just that. They're to supplement a good, healthy diet and lifestyle already. So I don't necessarily like replacing a supplement with a drug with a supplement if they're going to take it the rest of their life.
Right.
So can you comment on that?
Sure. So the things we use, we hope are just temporary, and that's what they should be. Because, like you said, we these things are not meant to replace your diet and your lifestyle. They're meant to supplement it when you need it. And sometimes, things happen in life. You get off track, and you need them to get you back on track. And that's how I kind of use those. So, but once we can kind of get your GI tract working like it should again, with all these things put in place, working in concert, then you don't need them. And a lot of people think they have to take probiotics every day, and probiotics are important, but it's prebiotics that are also very important. And prebiotics, guess what? Fiber. Where do you get it? Fruits and vegetables. Okay, so it's an important thing. I mean, this is what you need to be eating anyway. And so that fiber actually provides fuel to the gut microbes that inhabit your GI tract, and which allows them to do what they need to do, producing short chain fatty acids that we know are great for the gut lining. So there's so many things going on in that GI tract of ours that to me is amazing, and I'm always learning more and more and more about what these things actually do and how they keep us healthy if we can keep them healthy. So they're
So
your
Jen,
friends. Treat them like your
absolutely
friends.
right. Janet, what questions do you have for Dr. Beard on gut health?
Well, you see so many things out there as far as, if you just drink this or if you take this, and I've seen a lot about vinegar. Drink so much vinegar, and so what are your thoughts on some of those? Uh, what
Yeah.
would you call them?
Is it like the apple
Ideas?
cider vinegar? Is that what you're
Yeah,
talking
right.
about?
I am, because you see that a lot. Things like that pop up. Like, is it really beneficial in your mind to have an acid added into your diet, or how do you approach that with people? Because I have a lot of people that ask those questions, like, should I be drinking that? Should I be taking that?
I've had a lot of patients tell me that and they swear when they like, if they're having reflux or something, they'll use apple cider vinegar, and it works for them. And I'm like, "Okay, that's great. I don't
Right.
see any detriment to that. So, I have no problems with you doing that. But if you're using it all the time, let's why? Why are you having to use it all the time? That's what I'm always asking. But as far as the apple cider vinegar goes, I know a lot of people who use it and feel that it's helped them when they needed it, and I don't see any problems with people using it. It is impacting probably probably more so in the intestine versus the stomach is where I think it's probably doing most of its work. Not so much adding to the pH of your gut, because the pH of your gut is super low. Apple cider
Right,
vinegar.
right,
Well, and that's what I mean, you have to,
right,
vinegar, acetic acid has a pH of like 4.5, and you have to drink a whole bottle of it, and still to get your pH to 1, which is what your stomach acid is,
Right.
would be impossible.
Yeah, and
So,
people think that, like, drinking certain waters, or alkaline waters, are doing something. I'm like, as soon as it hits your stomach, it's doesn't matter. It's the stomach is so acidic, and it needs to be acidic so it can kill a lot of things that we eat inadvertently that could harm us. That's one of its jobs, is to kill those things. And so the thing about the alkaline water is primarily because it's mineralized like our water needs to be.
yeah.
That's where the magic is.
And don't forget with stomach acid too. It's there, a low pH like that will help dissolve minerals so we can
Right.
absorb them.
Yes.
And so when people are on chronic PPIs like Prilosec and Nexium and Prevacid, and you don't have an acidic stomach, you've got all kinds of malabsorption issues, from fat soluble vitamins
Mhm.
to minerals, and that's why we're supposed to have acid tummies. The acid's supposed to be
Right.
there to prevent bad things from being absorbed, but also dissolve good things to be absorbed.
Absolutely. Like I said, the pH is important. And the stomach, empties out into your intestine, and the pH needs to be correct so that it can activate all those enzymes and other hormones that have to be activated as well to do the job of digestion and absorption.
So one thing we love here is patient stories, and I'll bet you have a good patient story how you changed their overall health by fixing their gut. Do you have a good story to share about that?
Oh my, wow.
I
I
mean, you
mean,
got lots of them, right?
we address gut health on everybody, it seems, that comes into our clinic, because everybody's gut health is a mess. Um, I think the one that comes to my mind was a little boy who um, was he, his school was pressing the parents to put him on ADD meds. Right, he was having temper tantrums, could not focus, um, was acting out in school, very emotionally labile. He had horrible eczema on his arms. And so we put him through our kids' version of our total gut job. So we ruled out food sensitivities, which he had to gluten and some dairy. And so we got rid of that and then started just bombarding the body with, enzymes, omega-3 fatty acids, as well as probiotics and the whole thing. Right, we threw it all at him, and he was avoiding the gluten and the dairy components. And this was remarkable. This is the results that we got. His grades improved dramatically. He was this kid that was suffering in school, and all of a sudden, within one quarter, he was back up at the top of the class. His rashes went away. And his rashes were so bad that he was literally clawing himself because of the itchiness, clawing himself to death, where his mother, she was a nurse, and so she was having to wrap his arms with Coban so that he would not claw his skin to death. And so that went away. And then he was also a very small child, very frail looking, and he grew like overnight. His mom said he went up in like 3 sizes within 6 months after making those adjustments to his gut health. So now we have this kid that was doing horrible in school, not doing well at home either with his siblings. He was just, bless his heart, he was struggling in so many ways. He went from that to this. She showed me these pictures. He was smiling and happy, and his allergic shiners that he had under his eyes had gone away. No rashes anywhere, and he just looked better. And his mom said he's like a totally different child.
Wow.
And that was me. That was me when I was younger. And I didn't have
Yeah.
access to a functional medicine doctor who knew all about that. So I went decade after decade struggling with all kinds of chronic issues that if I had access to someone who knew about gut health, I wouldn't have had to suffer all that. And I'd still have my colon.
And putting somebody on ADD medications
Right.
is just
Yeah.
treating a symptom instead of fixing the problem.
And causing a lot more problems down the road.
Exactly. Yeah, absolutely. And that goes for adults as well, because ADD is something that adults are diagnosed with commonly, and they get put on drugs for it. And I think it's more of a, if they fix their health issues, they do not
It
need
gets
drugs.
better. It
Absolutely.
absolutely gets. I've seen it time and time again in adult patients. We can get them off their anxiety meds, their antidepressants, their ADD meds, just by addressing gut health, which also includes a lot of other things, right? Your environment, your lifestyle.
Yep.
Super important, yes. So I notice in the background, Dr. Beard, behind you, there's this book.
It's actually a signed copy too, I
Is
might add.
it? Well, I hope you've enjoyed reading Sickened, and we appreciate your time spending with us too, because I think as healthcare professionals, if we can help patients make informed decisions, then it's going to improve their outcomes. And I think a lot of people are starving for truth, and they're starving for people that are going to help them and allow them to make decisions for their health. So.
You
And
bet they
it,
are.
yeah, and in my book, Amy, and thank you for being on our show. In my book, I talk about a fix, and the fix is a 6-step solution, and you're part of it. Doctors need to get out of the traditional healthcare system and help to educate and empower people to take charge of their own health, and that's exactly what you were doing. So thank you so much for doing that and being a guest on our podcast.
You're very welcome. And like I told you earlier, I would rather go mow yards than go back to the other system.
I love it. I can't wait to meet you and your husband someday, because it's so nice meeting like-minded people, and it's so powerful for a doctor or pharmacist like myself to say things like you just said, because I'm along with you. To go back to traditional pharmacy, you could not pay me enough. I wouldn't do it. I would go pick another career. So fortunately, you and I have found something that we love inside of medicine and pharmacy,
Yeah.
and our patients are grateful for that, hopefully.
Yeah, I love helping people.
Absolutely.
Because I've been there. I have
Yeah.
been there. I have walked in the shoes of many of my patients, and so I can relate.
Yeah, that's why we went into healthcare, right?
Mhm, right.
So what's the best way for people to get a hold of you if they have any questions, Dr. Beard?
Sure. So visit my website. That's the best place. It's simply amybeardmd.com. That is my webpage, and you'll find contact information there. You can also follow me on Facebook, Instagram. We have a podcast, Self Care is the New Healthcare, which we hope to get going again once I complete my office renovation and find the time to do it. And so those are probably the best places to see. And I put out content all the time. Great
When you're
content.
when you're not being censored on social media.
I haven't been censored a while. I need to step up the game.
I know. I'm kind of offended, because Facebook is the only place I've never been censored. I'm offended that I don't get censored on Facebook. So I'm kind of jealous.
You're not doing something right, Shawn.
I guess not, right? So, well, there's your website if people want to get a hold of Dr. Beard, and just a wonderful resource information. So, Dr. Beard, thank you so much for being on. I totally appreciate it.
You're so welcome, Shawn, and we'll have you on our show as soon as we get it back up and
I
running.
would love that. Thank you so much.
You're welcome.
As always, listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. And I would tell you what our podcast is going to be Thursday, but I really don't know. So, but tune in because it is 8 to 9 a.m. And you know what? I will tell you, 8 to 9 a.m. Pacific time, we will have, let's see who we have on Thursday. Oh yeah, Dr. Brim from Brim Medical. He opened a cash only clinic and like an urgent care clinic, and I'm excited to have him on. So he will be talking about his clinic model 8 to 9 a.m. There's a lot more free market medicine type clinics coming into play now, whether it be surgery centers or whether they be primary care or functional medicine. I love it. Pioneers in medicine. So stay tuned, 8 to 9 a.m. Pacific Standard Time, right here on my personal Facebook page or the Moses Lake Professional Pharmacy YouTube site. Health Solutions with Shawn and Janet Needham. Thank you for tuning in.